Kills more Wisconsinites a year than car crashes. Opioids, a powerful prescribed painkiller, has overwhelmed communities across the country. In 2023, Wisconsin saw just over 1,300 opioid-related deaths. And to combat rising death rates, the state of Wisconsin has announced grants being awarded to law enforcement agencies statewide. Fox 21's Drew Kerner has more in Ashland, where the sheriff's office there is one of several agencies receiving these grants.
As Attorney General, my top priority is public safety, and one of the biggest threats that we face in this state to public safety is the opioid epidemic.
Wisconsin Attorney General Josh Kaul came to Ashland on Thursday as part of his statewide effort to combat the opioid crisis. Wisconsin will receive $750 million from pharmaceutical companies for their role in the opioid epidemic. The state will allocate these funds through 2038 to try to prevent and reduce the dangers to the public.
Given our opioid epidemic in the county, we weren't really seeing results, reoffenders coming back to jail, and this program seemed to help establish some kind of program where they can come in, get those services. We can have an intervention in jail, supply the counseling, and then have an exit plan for them as well.
The Ashland County Sheriff Department was awarded $250,000 to treat incarcerated people who struggle with opioid use. 11 other law enforcement agencies were also awarded these grants. 70% of the funds will go towards communities and local governments. 30% will go towards the state's Department of Health Services.
Right now in facilities in Wisconsin, correctional facilities and jails, a huge percentage of people who arrive in the facilities come with an opioid use disorder, with a mental health challenge, or in many cases with both.
The county plans to start a medication-assisted treatment, or MAT, for incarcerated peoples. These treatments utilize drugs like methadone and other drugs to allow the addict to taper off from their dependency.
We've been talking about MAT in the jail for several years, and the biggest hurdle has been resources. We didn't have funding, we didn't have staff available to do it, and so this grant, almost $250,000, will really help us get this program going.
Other projects aim to train staff to treat dependency, connecting users to social services, and distributing community drug disposal stations.
I think it's also the right thing to do to make sure that treatment is available to people so that they have a chance to succeed for their own reasons as they're re-entering after incarceration.
And they may reoffend in the future, but we'll start that program all over again and not give up on them.
In Ashland, I'm Drew Kerner, Fox 21 Local News.